Good afternoon, everyone. We are going to go ahead and get started. My name is Carmen Anderson, and I'm presenting today on behalf of the U.S. Medical Compression Alliance, and we're going to go through some of the updates to Medicare coverage for 2025. So just a quick housekeeping, participants are going to be in listen-only mode. If you do have questions, please type them into the Q&A chat box. And at the end of the presentation, we'll try to go through those if we have time, or Holly is assisting me today, and she'll try to answer those questions throughout the webinar as well. Just a reminder, this is information that we have learned. It's been our experience during the Lymphedema Treatment Act. If you have specific questions, please seek out appropriate professional advice. For an agenda today, we're going to do a recap of the Lymphedema Treatment Act. We'll go through some terminology. We will also talk about the changes to Hipic codes, the history, and then what's new for 2025. And we'll also do a quick review of the publications from Medicare and the DME MACs. And then, of course, again, we'll go through questions as time allows. Just a disclaimer, we will not get into claim-specific billing questions or clinical recommendations today. If you do have those kind of questions, we would really encourage you to contact the appropriate organizations. There's a number of them available to you. So just as a reminder, what started it all? Lymphedema compression garments were not originally covered by Medicare, and CMS, or the Centers for Medicare and Medicaid Services, did not have the authority to change that because the definition of compression garments didn't match up with the DMEPOS categories. So only Congress had the authority to change that definition or create a new benefit category. So it started with the Lymphedema Advocacy Group, or LAG, and they spent over 12 years advocating for Congress to pass the Lymphedema Treatment Act, or the LTA. It finally passed at the end of December in 2022, and it gave stakeholders 1 year to prepare for coverage to go live on January 1st of 2024. During that preparation time, the U.S. Medical Compression Alliance came back together and really wanted to strengthen their advocacy efforts. It's made up of different garment manufacturers: Jobst, Juzo, L&R, Medi, Sigvaris, and Tuan. And our mission is really to advocate for patient access, to lymphedema and venous compression garments to help make sure that patients get what they need. So to cover the basics, again, coverage went into effect specifically for Medicare beneficiaries on January 1st of 2024. Those coverage decisions are made on an individual claim-by-claim basis by the DME MACs, or the Medicare Administrative Contractors. There's two different MACs, Noridian and CGS, and they process the claims for Medicare. Coverage is limited to individuals with a diagnosis of lymphedema, not other illnesses. And so there's 4 specific ICD-10 codes that the DME MACs will consider for coverage: I-89.0, Q-82.0, I-97.2, and I-97.89. The frequency limitations have also remained the same for 2025. The Lymphedema Treatment Act got coverage for both custom and standard or off-the-shelf products. Then they've broken it out into 2 different groups. There's daytime and nighttime. From a daytime perspective, 3 units per affected body part are eligible for coverage every 6 months. For nighttime, it's 2 units per affected body part eligible for coverage every 2 years. For products like accessories, those donning and doffing aids, there's not a specific frequency limit or replacement on those. That's really based on clinical need. So the medical record documentation needs to support how many and how frequently they're needed. From a bandages perspective, there's also not a quantity or frequency limit. It's based on clinical need, and bandages are covered during both phase 1 and phase 2 of treatment. I do want to touch on some vocabulary for distribution, refill, and replacement, because now that the Lymphedema Treatment Act has been live for a little over a year, we're coming up on that time when patients are maybe getting additional products or new products. So when we say distribution, we're talking about that original dispensement of the products to the patient. So the first time that they receive their compression garments. A refill is when that original order is refilled or provided on a recurring basis. A replacement happens when a product is lost, stolen, or irreparably damaged. From a distribution perspective, it's important to note that you do not have to deliver or dispense all of the products on the same date of service, and that applies to both off-the-shelf and custom garments. And an example scenario would be for a custom product, you may get one product or distribute one product. You want to make sure that it fits that patient appropriately, and then you order the 2 additional custom garments to be delivered. It's important to note that suppliers can ship products, but they're still responsible for those other components, the taking measurement, performing fitting services, training the patient on donning and doffing, showing them how to take care of the item, and any adjustments. We've had some conversations about what that 6-month timeline looks like, depending on when products are dispensed, or of course the 2-year timeline for nighttime products. And there's really some ambiguity or vagueness in some of the publications. So we have reached out to the DME MAC medical directors and asked for specific clarification for different scenarios for when products are dispensed at the same time versus if they're dispensed on different dates. We've requested that guidance from them, and as soon as we receive a response, we will share that with people that have registered for the webinar, and we will share that information with them as soon as we get a visual example that we can help use to educate everyone. From a refill perspective, a routine prescription for refills is not required. So if a prescription is written for compression garments and then that 6-month time frame passes for daytime, or the 2-year time frame passes for nighttime, a refill does not require a new prescription as long as everything remains the same. If there are changes to that original prescription, then a new one is required. It's important to note that medical records have to support that those items continue to remain reasonable and necessary. So medical record documentation that indicates that compression is still a part of that patient's treatment plan, that it's required for maintenance, etc. And they reference timely documentation, which means it has to be in the medical record in the preceding 12 months. In order to supply that refill, suppliers must contact the beneficiary and document prior to dispensing the refill. And there's a couple of bullet points there to consider for what suppliers need to do. They also need to track that proof of delivery as well. Replacement comes into consideration where if a product is damaged and when it needs to be replaced, So one of the examples is that if a daytime garment is lost, if it's stolen, or if it's damaged, you can submit for a replacement of all 3 of those quantities. And it's not just limited to when something is lost or damaged. It's also if the patient has a substantial change. So if there's a change in their medical or physical condition that warrants a new size or type of garment, that's also considered for replacements. In either case, it's important to note that when replacements are provided, it restarts that date of service or that distribution clock for when patients are eligible for their refills. And something to note is that you'll need to have documentation to support why a replacement is needed. So make sure there's documentation tracking what's causing the replacement need. So then let's go back and take a look at Hipic codes and the history and what has changed for 2025. When the Lymphedema Treatment Act was passed, there was a number of codes that technically already existed to describe compression products, but there was fewer than, I believe, 35 codes, and that was not enough to cover everything that was available on the market. As you know, lymphedema patients have been needing and receiving compression garments for a long time. The manufacturers have created products that clinicians desired and that patients needed. There was approximately 25,000 different types of compression products on the market before the Lymphedema Treatment Act. So we had to take those 25,000 products and try to identify specific codes to match up those products to. During that preparation year of 2023, we requested 229 codes to be published for lymphedema compression garments. When Medicare published their final list, there was only 78 codes. So those 25,000 products on the market had to fit into those 78 codes for 2024. In order to request new codes, you have to go through a formal application process. The U.S. Medical Compression Alliance did that because we want to advocate for additional codes to describe the products that are available. We did present at a public meeting in November, and we were able to successfully advocate for 12 new and revised codes. Those go into effect April 1st of this year, and we'll dig into each of those. But just know that there's more work to be done, and we'll continue to advocate for additional codes. So let's break down what's going to change starting April 1st of 2025. Looking at adjustable wraps, there was a number of codes that had their descriptions revised. So on the left-hand side of the screen, you can see what those code descriptions were in 2024. And we'll just go through those line by line. So it's what they were in 2024, and then what they're going to become on April 1st of 2025. So that first row looks at code A6583, and it's a gradient compression wrap with adjustable straps below knee, 30 to 50 millimeters of mercury. This was just a crossover or carryover code from the surgical dressing products that had that 30 to 50 millimeters label on there. None of the other adjustable wrap codes that were published for lymphedema had that specific millimeters of mercury label. So we asked that they take off the 30 to 50 on the below knee product. Medicare agreed with us. So if you look over to the right, you can see that they removed that 30 to 50 designation for the below knee product. The next couple of products on there, you can see I have highlighted pressure on the left-hand side of the screen. That was really just a clerical semantic piece that needed to be changed. Some of the wraps said gradient pressure wrap, while some of them said gradient compression wrap. So Medicare agreed and they updated those for consistency to say gradient compression wrap with adjustable straps. Next, we'll move on to adjustable wraps custom products. So that initial publication that had 78 codes, they published adjustable wrap codes, but only off-the-shelf or standard versions. There was potentially a misunderstanding of adjustable meaning custom, but we know that's not the case. Adjustable is really just meant to allow for volume fluctuations throughout the day. It's not truly a custom product that's individual measurements for each patient. So we pointed that out and requested that custom counterpart codes be made for those adjustable wrap products. Medicare agreed with us, and they published custom wrap codes for each of those anatomical locations you see on the screen. So the full leg, foot, below knee, arm, and above knee will have custom wrap codes starting on April 1st of this year. Another change that was made was to the not otherwise specified codes. So that, again, that first list of 78 codes, it had a generic, not otherwise specified code. We were concerned that without differentiation between daytime and nighttime, it would be difficult for suppliers and billers, and also for the DME MACs that are processing claims to differentiate between those products for replacements, for refills, just for quantities and frequencies. So we asked that they differentiate between daytime not otherwise specified and nighttime not otherwise specified. And so they did agree with us, and they published a new code, A6519, for nighttime. And then they updated the description on the existing code of A6549, and they specifically added daytime to that code. So while we successfully advocated for those 12 codes to be updated or created, there were some other topics that we covered and have some additional information on. We had also requested specific anatomical segmentation for bandage liners, because right now there's only an upper extremity and lower extremity bandage liner product, and we were hoping for additional segmentation there. Medicare disagreed at this time, and they said that they wanted us to just continue using those codes. So we will continue to advocate for that and hopefully can see change in the future. Another thing that USMCA requested was missing anatomical locations for nighttime and adjustable wrap products. So we already talked about adjustable wraps, and there's below knee and above knee, but there's not a knee. And there's some other locations that are missing. So we asked to please create additional codes for that. Or for nighttime, for example, there's not a head and neck code, so we asked for that to be created. CMS did not agree with us. They said that they do not yet see an operating need, but they said that they would defer their final decision to a future date. What that means is that the U.S. Medical Compression Alliance needs to gather data to prove that there is a need for a specific HCPCS code for these products. And so we need to create a data file essentially that proves that patients need that product, that clinicians are prescribing that product. So we are working on that, and we'll be able to bring data to CMS in the future. Other things that we want to look towards in the future are additional fee schedule concerns or additional coding descriptions and changes. And so we certainly want to hear feedback from you all that are living everyday billers, patients, clinicians. We want to hear from you what codes you think are needed or potentially what other items we need to address. A quick reminder, one of the acronyms that you will frequently hear is Pedac, and that stands for the Pricing, Data Analysis, and Coding Contractor. They are a contractor for Medicare, and what one of their roles is to verify that a product belongs in a certain HCPCS category. And so manufacturers can submit applications for their products to get a product aligned to a specific HCPCS code. As of right now, that is a voluntary process for lymphedema compression garments. Some DME items mandate or require that they are verified through Pedac, but as of today, that is voluntary for lymphedema compression garments. There are pros and cons to that. It can be beneficial for billers to have that when they submit claims for specific products, just to show that alignment of the product to a specific HCPCS code. But it is also important to note that a Pedac verification letter in and of itself does not impact medical necessity. So if a claim gets denied or a claim gets reviewed, a Pedac verification letter in isolation is not going to help get that claim paid. The medical record documentation is really what justifies the products provided to those patients. For the new HCPCS codes that have been published, the USMCA members, they'll work with Pedac to do those applications as appropriate. Another thing to note from a reimbursement perspective, for lymphedema compression garments, they have payment amounts that are published in the fee schedules. And as of right now, those are national payment amounts. There's not variation between different states or rural areas. A number of the codes are assigned specific fee schedule amounts. The most recent publication came out for January, and that fee schedule showed an increase for 2025. There's a 3% increase for 2025 in comparison to 2024. For the 12 new codes that I discussed, The new codes do not have a specific national payment amount tied to them. So their reimbursement amount will be decided on a claim-by-claim basis. And that's really mostly specific to those custom wrap codes and, of course, the not otherwise specified codes. So no specific fee schedule. The payment amount will be decided on a claim-by-claim basis. Another thing to call out for those suppliers, just a quick reminder, in order to bill Medicare, they must be enrolled as a DMEPO supplier with Medicare, and there's not a separate payment for fitting. This was published in the final rule by the Centers for Medicare and Medicaid Services. They are staying consistent with other DME products that the national payment amount made to the supplier includes all necessary services. So that includes fitting. There's not a separate payment for fitting at this time. The supplier is responsible, again, for taking those measurements, performing fitting services, training the patient, showing them how to don and doff the product, and how to take care of it. I also wanted to summarize some of the publications and resources that have been shared by CMS and the DME MACs. They are all over the different websites. And so what the USMCA has done is we've really tried to consolidate those so you don't have to go searching for them. If you have a question about billing or what can or can't be provided to patients or how things work, a lot of the answers exist within the documents that have been published by CMS or the DME MACs. They can be tricky to find. So again, that's why we've tried to consolidate them on the USMCA website. So you can see on the right-hand screen there, there's a QR code. If you hold up your cell phone and open up your camera and scan that QR code, it will take you to the USMCA website and you can click through those different things. And just a reminder, I'll have QR codes up on the webinar today, but if you go to the USMCA website, all those different QR codes and the sites they link to are consolidated there. So a number of the publications that have come out, they've done frequently asked questions. They've talked about duplicate billing. There's some different articles about coding, some documentation checklists, and also a publication about home health. So I'll go through a couple of those today just to dig in a little bit more. Some of the frequently asked questions that come through, there is not a face-to-face encounter requirement for this. There does have to be medical record documentation, but not necessarily that face-to-face physician encounter requirement. They do consider concurrent coverage for pneumatic compression devices and compression garments. The DME MACs are considering options for an LCD or PA. LCD stands for Local Coverage Determination, and PA stands for Policy Article. Local Coverage Determination is really just another word for a medical policy that establishes different criteria or eligibility reasons for why or when a patient can have a specific product. So as of right now, the DME MACs said they're considering it, but they haven't put any timeline or parameters around it. There's pros and cons to an LCD, but at this time, it's important to remember claims are still being decided on a claim-by-claim basis, and the most important part of that is medical record documentation justifying why a certain product has been prescribed to a patient. From a payment perspective, one thing to note is that for those patients like in a skilled nursing facility or hospital stay, if the Part A benefits have ended, then lymphedema compression treatment items are considered separately payable. So they are eligible under their Part B benefit, but not their Part A benefit. They are also separately payable during home health and hospice, as long as it's not related to that terminal diagnosis. Duplicate billing is something that comes up often as well. And the important thing to remember from this is for those patients that are getting bandaged and going through that decongestive process. I know some patients also use bandages during maintenance. But something that will happen is that there are 16 Hipic codes specific to bandaging products for lymphedema. If those 16 Hipic codes are billed on the same day as a CPT code for bandaging, the claims will be denied. And so it's important to make sure that those two things are not occurring on the same day. So not billing for the products on the same day that a clinician is billing the CPT code for application. And again, that QR code on the right hand will take you to the publication from Medicare about that specifically. So I've talked all about Medicare today, but what about the other payers? So Medicare Advantage, Medicaid, and private payers. Medicare Advantage should cover at least what Medicare does, but each plan that's administering these is acting a little bit different. And so we're still navigating and gathering information about that, or there might be different processes where they require prior authorization. And so it's really still a learning curve for everyone while we navigate Medicare Advantage. From a Medicaid perspective, each state gets to operate independently. And so again, they are working on incorporating those HCPCS codes, and they may have different policies. And so we're gathering additional information about what patients and clinicians are experiencing with different Medicaid plans. On the private payer side, they may use their own commercial policies, or they may adopt some of the Medicare policies as well. One of the things that we want to stress is that getting your feedback from the real world day-to-day is really important to us. And I've mentioned the Lymphedema Advocacy Group earlier. They have a denial reporting form. And a denial can mean a lot of different things, but we want to try to capture some of the patient, clinician, and supplier experiences for getting access to their lymphedema compression products. So I would encourage you to scan this QR code specifically because it will take you to that LAG denial reporting form. So if a patient's not able to access a product, you can go in there and share your experience. And then we are working with LAG. We want to take that information and share those stories and experiences with Medicare, with Medicare Advantage, with whatever payers that we're seeing issues with, so that we can try to change negative outcomes into positive ones. On the supplier side, we also want to hear from you. So if you supply lymphedema compression garments, we want you to take our DME survey. So this QR code is for you, for those suppliers out there. We want to get some feedback so that we can also try to support your efforts as well. We're trying to determine interest in a supplier coalition. And so for suppliers that are interested, please send an email to that contact@usmedicalcompressionalliance.org, and we'll keep you informed as that evolves. A side note, I will be presenting at MedTrade next week. If anyone is there in Dallas, please stop by my presentation Tuesday afternoon at 3:30. So just a quick recap of what we talked about today. The basic Medicare coverage details have not changed. There is not an LCD or policy article yet, so claims are still being decided on a claim-by-claim basis. There are 12 new and revised HCPCS codes that will go into effect April 1st of 2025. USMCA is going to continue to seek additional codes to support patient access to the variety of products on the market. We are really still learning. There's still a lot to advocate for, and there's going to be more changes in the future. So we really want to help continue to be a source for education, to consolidate resources. So really encourage you to visit our website, usmedicalcompressionalliance.com, to stay up to date and take a look at everyone. Thanks, everyone.